My name is Sue Ang, and I'm your host. I'm here at the headquarters of Symptometry, a groundbreaking health consulting company, and I'm here to interview the founder, Dr. Maxwell Nardi. Let's get started. Dr. Nardi, nice to meet you, and thank you for the time today. As the founder of Symptometry, can you tell me how you started the company and why?
Initially, I did not intend to set up Symptometry at all. I was a very sick man. And if I should go into details telling you about all my illnesses, okay, I can tell you right now, this face that you see was not as smooth as it is now. It was full of acne. And when you have this acne, popping left and right and bursting, and with pus falling out and coming out and all that, it affects your self-esteem. You become indifferent and you become moody. So you don't have many friends. What did I do? I found a way to treat myself in such a way that I addressed the root of the problem. And this was in my diet, because I like eating nuts. I like eating bread and butter. And nobody told me that all these were wrong. So I eliminated the wrong foods, and then I found a way to remove the fats that were clogging my pores. And this was how I cured acne. So for the past 22 years, I have not had one single acne on my face.
That's amazing.
This is how root cause therapeutics applies to health. What are some of these roots? They are in the chemicals, in the foods we are consuming, and in the beverages we are also consuming. So if you know where the root is, then you can easily remove the root by advising the person to stay away from this food or from that food. That is the best way to address the root of human diseases, instead of just treating the symptoms with pharmaceutical drugs or with herbs or with vitamins and without getting any results. These have been tried for over 5,000 years. And why is it that results are not being obtained? Results are not being obtained because using the same method all over again does not guarantee new results. You are still going to get wrong or bad results. So that's why I founded Symptometry, so that mankind should have a different and better way to address the roots of our diseases and our symptoms. Thank you.
So the fundamental of Symptometry then is diet?
The fundamental of Symptometry is the kind of food that will not hurt your cells.
Okay. That's very interesting. So there's a lot of companies that promote healthy eating. So how is that different from Symptometry?
There are different companies that promote healthy eating are not the same as what we do, because I spent 14 years in the laboratory to deconstruct the various foods and know the chemicals, natural chemicals in the foods that hurt our cells. This is what other companies have not done. Other companies are just repeating what theories are out there. I departed from these theories and I went to the laboratory and I found out exactly what is making people sick.
Okay.
And this is the difference between what we do in Symptometry and what others do.
It's very interesting. So if someone comes in here for a consultation, what should they expect?
If they come for a consultation, well, what they should expect is I will be asking them questions that may go back 30 years, going back to their childhood. What were the most recurrent ailments you were having when you were a child? And then what kind of foods did your mom and your dad serve you when you were a child? And you see that there will be a pattern. And this pattern is going to entrench the root of your disease in your body. unless you depart from the way you were eating for the past 30 years, you are not going to get results. Because the problem is coming from the food you've been eating, from the drinks you've been having, and from your general exposure to health disruptors.
So someone might come in for a consultation and feel empowered and maybe stop going in for check-ins. And what is your opinion on that?
I will always recommend that people go in for a medical checkup periodically, because there will be some abnormalities in blood that may not be seen on the skin. There will be some abnormalities that may not be seen in a person's liver unless a blood test has been done. Then we can correct these abnormalities. So we will advise people to go to a physician for a diagnostics. Once this has been obtained, they can come to us for root cause therapeutics.
So it's all about the team effort. So the idea of community engagement is important to you. Can you explain a little bit about that?
Well, community engagement is very, very important because, well, we have people in the community who are in there as brothers, sisters, mothers, cousins, uncles, and so on and so forth. They are there to support us. And you cannot embark on the path to health by yourself, because you need nurturing. And this nurturing is coming from your loved ones. So you talk about diet, you talk about lifestyle, you also need nurturing, because we are human beings.
Yeah, that's interesting you bring up caregivers, because we tend to forget about the caregivers when we're always focused on the person who's recovering. So why do you feel that caregivers need to relax, and what are some of the things you do to relax?
Well, the caregivers have to relax because we are imparting vibrations. Positive vibrations help to offset the negative vibration in a person who is sick. When a person is sick, the person is depressed. So stress adds to the disease to complicate matters.
Right.
So if you have a caregiver who has specialized in elevating the mood of the sick person, this will be an added input to the recovery of the sick person.
Yeah, it's amazing what stress can do to your body, and you don't even see it sometimes, but it's just so draining to people. So what about the other professionals?
Well, as far as the other healthcare professionals are concerned, they are all important. Everybody is important. It's just like a car. You have the tires that are as important as the engine. You have the steering wheel that is as important as the engine and the tires. This also applies to all the healthcare professionals. The physicians are important. The nurses are important. The nursing aides are important.
So you often dedicate your books to your family. So as a father and grandfather, how has it affected you in your approach to symptometry?
Well, charity begins at home. And once you have a solid foundation from home, once you have a network of support from home, it spreads to the whole world. So this is why I always dedicate my books to my family, because they were there when the rest of the world was not paying attention. So by paying attention to me, they helped to push me forward, and now the whole world is knowing about Symptometry.
And you've written some books. Can you talk a little bit about those?
Well, I've written several books. The Downside of Nutrition is a flagship book of Symptometry. This is the result of the 14 years of chromatographic research that I've done, and I've broken down what is in tea, what is in coffee, what is in corn, what is in plum, and all that, so that people should know exactly what is in the food they are about to eat. So if they know what is in the food they are about to eat, the question is, should they eat it every day, once a week, twice a month, At least they are being enlightened on what is in the food. Unlike the past, where nutritionists only told us that this is good for you without giving us the scientific reason why it is good or it is not good. Now we have science backing up all the chemicals that are in the food, even though they are natural. But you have the book called The Downside of Nutrition, part 1. And in that book, I've detailed the enzymes that are needed, and the chemicals that will break down the cell machinery very fast in order to make a person sick, the chemicals that will make a person's blood very dirty very quick. And it's better for people to know about all this so that they stop wading in complete darkness anymore.
Great. Speaking of your books, they're written at an 8th grade level, and you're a well-educated man, and you've had the opportunity to study around the world. Why did you choose that writing style?
I chose the writing style because what I discovered was, when I was studying anatomy and physiology, I realized that this was not accessible to the general public. So I decided to bring them in by making the books readable and accessible to all of them, so that they could read these books in the comfort of their home.
So that's great. So where can people find more information about symptometry?
The website of Symptometry is www.symptometry.com.
So thanks so much for your interview, and thank you for all the viewers for joining in.
Thank you very much.
Thank you.